Most people assume that getting older is something that sneaks up on you gradually, a grey hair here, a slower step there. But let me tell you something that most doctors won't say out loud in a short appointment. Once you cross that threshold of 80 years old, your body begins a series of very specific, very predictable changes that are not optional, not reversible in the traditional sense, and not something you can simply sleep off or ignore. And the frightening part, most people over 80 don't even realize these things are happening until the damage is already done. So if you are 80, approaching 80, or you love someone who is, stay right here, because what I'm about to share with you could genuinely change the quality of the years ahead. Let's start with the very first thing that happens to virtually every single person once they turn 80, and that is a dramatic acceleration in muscle loss. Now, you may have heard the word sarcopenia before, which is the clinical term for age-related muscle wasting, but what most people don't understand is that this process, which starts slowly in your 40s and picks up pace in your 70s, almost doubles in speed after 80. We're not talking about the kind of muscle loss where you simply look thinner in the mirror. We're talking about functional muscle, the deep, stabilizing muscles in your core, your legs, your hips, the ones that keep you upright when you stand up too fast, the ones that catch you when you slip on the bathroom tile, the ones that allow you to carry your groceries in from the car without needing to rest. Studies out of major research universities have shown that adults over 80 can lose as much as 3 to 5% of their remaining muscle mass per year without targeted intervention. That might not sound like a lot, but compounded over just a few years, the cumulative impact on mobility, balance, independence, and even cognitive function is enormous. Now, here's what you need to understand. This is not a death sentence. The body at 80 still responds to resistance. Gentle strength training, and I'm not talking about lifting heavy weights at a gym, I'm talking about resistance bands, chair exercises, wall push-ups. Even slow walking with deliberate steps can meaningfully slow this process. The key is consistency. 3 to 4 times a week, even for 15 to 20 minutes, sends a powerful signal to your aging muscles that they are still needed. And your body listens. Protein intake also plays a massive role here. Most elderly adults are chronically undereating protein, partly because their appetite shrinks, and partly because no one told them the rules change as they age. At 80, you actually need more protein per pound of body weight than you did at 40, not less. Something around 1 to 1.2 grams of protein per kilogram of body weight per day is what the research supports. That means if you weigh about 150 pounds, you need roughly 70 to 80 grams of high-quality protein every single day. Eggs, Greek yogurt, legumes, lean chicken, fish, these aren't just foods, they're medicine for your muscles at this stage of life. Now let's talk about the second major change, and this one surprises people more than almost any other. Your immune system undergoes what scientists call immunosenescence, which is essentially immune aging. After 80, the immune system doesn't just become slower, it becomes dysregulated. It starts to lose its ability to distinguish between genuine threats and harmless substances. It becomes less effective at fighting new infections it hasn't seen before. It becomes slower to mount a defense even against familiar pathogens like the flu or pneumonia. This is why pneumonia, which is manageable and even trivial in a healthy 40-year-old, becomes one of the leading killers of people over 80. And it's also why simple infections, a urinary tract infection, a cut that gets mildly infected, even dental bacteria, can cascade into something far more serious in an octogenarian than they ever would in a younger person. But it's not just about fighting infection. The dysregulation of the immune system also means that chronic low-grade inflammation becomes a constant background noise in the body. Scientists call this inflammaging, the combination of inflammation and aging. This persistent inflammation is now understood to be a major driver of cognitive decline, cardiovascular disease, joint deterioration, and even certain cancers in the elderly. So what can be done? Sleep is the single most powerful immune regulation tool we have, and yet it's the one most undervalued in elderly care. Adults over 80 need between 7 and 8 hours of quality sleep, and disruptions to this, whether from pain, medication side effects, anxiety, or poor sleep hygiene, directly impair immune function. Vitamin D deficiency is also rampant in this age group and has a direct negative impact on immune performance. Sunlight exposure, supplementation under medical guidance, and foods like fatty fish and fortified dairy all help address this. Reducing sugar and ultra-processed foods which fuel the inflammatory pathways is not just a wellness tip at 80, it is genuinely critical medicine. The third change is one that many families quietly notice but rarely discuss openly, and that is cognitive shifting. Now let me be very precise here because there is an enormous difference between normal cognitive aging and dementia, and far too many people confuse the two. After 80, virtually everyone experiences some degree of processing speed slowdown. The brain simply takes a little longer to retrieve information, to switch between tasks, to learn new things. This is normal. This is not Alzheimer's. But what is also true is that the risk of actual dementia, Alzheimer's disease, vascular dementia, Lewy body dementia increases dramatically in this decade of life. By the age of 85, nearly a third of all adults show some form of clinically significant cognitive impairment. The reasons are complex and layered. Reduced blood flow to the brain, accumulation of amyloid plaques and tar tangles, neuroinflammation, shrinkage in key brain regions, and in many cases the side effects of multiple medications working against each other in ways no single doctor fully tracks. The concept here that you must understand is what researchers call cognitive reserve, essentially, the brain's resilience and its ability to rote around damage. People who have spent their lives reading, learning new skills, staying socially connected, and engaging in complex thinking have more cognitive reserve. This doesn't make them immune, but it means their brain can tolerate more deterioration before symptoms become visible. It's like having more fuel in the tank. So for someone who is 80 right now, the prescription is not passive acceptance. It's mental engagement, crossword puzzles, learning a new language, even just the basics, playing an instrument, maintaining active friendships and conversations, and staying curious. These are not hobbies. These are neuroprotective behaviors with real measurable impact on brain aging. And critically, managing cardiovascular health at this age has a direct impact on brain health, because what is bad for the heart, high blood pressure, high blood sugar, high cholesterol, is also destroying the tiny blood vessels that feed the brain. Let's move to the fourth change, and this is the one that most directly affects daily quality of life. Sensory decline accelerates sharply after 80. We are talking about vision, hearing, and balance, the three sensory pillars that together keep a person safe, connected, and independent. By 80, most people have already adapted to some degree of hearing and vision loss, but what happens after 80 is not just more of the same. The changes become more complex. Depth perception deteriorates, making stairs and uneven surfaces genuinely dangerous. Peripheral vision narrows, creating blind spots that didn't exist before. Contrast sensitivity, the ability to distinguish an object from its background, declines, which is why falls so often happen in low light conditions. Hearing loss at this stage is no longer just about missing words in a crowded restaurant. It begins to affect how the brain processes language altogether, increasing cognitive load and contributing to social withdrawal and isolation. And isolation, we now know from decades of research, is one of the most powerful accelerants of both cognitive and physical decline in the elderly, comparable in its health impact to smoking 15 cigarettes a day. What must be emphasized here is that the most dangerous consequence of sensory decline is falls. Falls are the leading cause of injury-related death in adults over 65, and the risk spikes dramatically at 80. A single fall resulting in a hip fracture has a mortality rate within 1 year of between 20 and 30% in this age group. That is not a statistic to gloss over. That is a crisis hiding in plain sight in millions of households. Regular eye exams, proper hearing aids when needed, removing trip hazards from the home, installing grab bars in bathrooms, improving lighting throughout the living space, and doing balance-specific exercises like standing on one foot near a wall for support. These are not small conveniences, they are life-saving interventions. And that brings us to the fifth and perhaps most emotionally significant change, the shift in how medications work in the body, combined with what's known as polypharmacy, the use of multiple prescription drugs simultaneously. The average American over 80 takes more than 5 prescription medications daily, and a significant portion take 10 or more. Here is what changes after 80 that makes this so dangerous. The kidneys and liver, which are responsible for processing and clearing medications from the body, become significantly less efficient. Drugs that once cleared the system in hours now linger for days. Fat-soluble medications accumulate in tissues. Water-soluble drugs reach higher peak concentrations because of changes in body composition. And most importantly, the drug interactions between 5, 7, 10 different medications become exponentially harder to predict and manage. The clinical term for this is adverse drug reaction, and it is one of the most underdiagnosed and underreported causes of confusion, falls, hospitalizations, and death in the elderly. A person who seems to be developing dementia may actually be experiencing drug-induced cognitive impairment. A person who keeps falling may be on blood pressure medication that is dropping their pressure too low when they stand up. A person who is depressed and withdrawn may be experiencing the emotional side effects of a medication that was prescribed years ago for a completely different reason and never revisited. What needs to happen, and what every family member of an 80-year-old needs to actively advocate for, is a comprehensive medication review by a geriatric specialist or pharmacist who specializes in elderly care. This review should happen at least once a year. The goal is to identify any medications that can be safely tapered, discontinued, or replaced with something better tolerated. This process, called deprescribing, has been shown in multiple clinical studies to improve quality of life, reduce falls, and even improve cognitive function in elderly adults. It is not about giving up on treatment. It is about making treatment smarter, safer, and more appropriate for the body as it actually exists at 80, not as it existed at 60. So let's bring this all together, because you came here for clarity and you deserve to leave with it. Once you turn 80, your body begins a new chapter, defined by accelerated muscle loss, a dysregulated immune system, shifting cognitive function, profound sensory changes, and increasingly complex medication dynamics. None of these things have to mean helplessness. None of them have to mean the loss of dignity or joy or purpose. But they do demand awareness, they demand proactive action, and they demand that you or someone who loves you takes these changes seriously rather than normalizing them as just getting old. Consistent, gentle exercise, high-protein nutrition, quality sleep, sensory health monitoring, fall prevention, cognitive engagement, and an aggressive annual medication review are not luxuries. They are the blueprint for living well at 80 and beyond. If you found this information valuable and you want to make sure someone you love hears it too, please share this video with them right now. Subscribe to this channel so you never miss content like this. Give this video a like if it gave you something worth knowing, and drop a comment below telling me what health topic you want me to cover next, because your questions and your stories are exactly what drives this channel forward.